Hello, everyone. Welcome to today's webinar. I'm Joe Lopez. I'm part of the Klara team. I'll talk a little bit more about myself in a minute. Just wanted to put a name to a face. We're going to give people just one more minute to see if anybody else attends, and then we'll kick things off. Today we are going to be talking about real-life practices, implementing and utilizing Klara as a means to manage communication with patients and the patient experience, which is a topic that comes up often these days in healthcare as patients, continue to look for better ways to build a relationship with their healthcare providers. All right, I think we can get started. It looks like we got critical mass. So we're just going to jump real quick into kind of who's here, though do have to kind of amend that Dr. Carmichael is running a little behind. We have myself, Joe Lopez, and Melissa Ozdemir from Pediatric Associates of Jacksonville. And I would like to turn it over to you, Melissa, since you're here, and give you a moment to talk a little bit about yourself.
Sure. Thank you so much for having me today. So our practice has been using Klara for the past several months now, and it's really improved our patient communications. We have 3 locations in Jacksonville, Florida. We are a pediatric practice, and we also have an integrative medicine side to our practice as well, which is led by Dr. O, as her patients lovingly call her. So we're actually able to use both sides of the communication platform for both of the practices. And we've had the pediatric practice since the 1930s, and then the integrative practice for the last 10 years or so.
Great. Thank you, Melissa. That's great to hear. And as I mentioned, my name is Joe Lopez. I am the VP of Product for Klara. I'm responsible for what we're building, the way we're going about bringing it in the market, working with a very talented team to develop that. And I am previously to joining Klara, I used to work for Athena Health. So I'm very familiar with Athena Health as a platform and a product. I can speak to that a little bit as well, how we work with them. When Dr. Carmichael joins us, we'll ask him to introduce himself and share a little bit about him and his organization. So we're going to move into our agenda now. We're going to spend about the next 30 minutes talking through a couple of these different scenarios, topics around communication and what does it do, what does it mean inside of the new kind of evolving patient experience. And along the way, Melissa and Jim will share some of their insights at the end of each section. As we go through this, if you have any questions that you want to ask in the areas that we're covering, please submit them through your interface, and we will go through that in the last 10 minutes. We'll do an audience Q&A, but we can definitely see questions as they go. And if there's something that's particularly of value while we're in sessions that everybody needs to hear while we're talking about it, we'll also try to highlight those and answer them as we go. All right, now let's just jump into it. So let's first talk about the challenges of communication within the healthcare industry as a whole and how that affects patient experience. What we know from our research is that patient complaints primarily are very small when it comes to the clinical care, about 4%. But when it comes to the customer communication and the service, that's where the bulk of patients run into a lot of issues. We see about 96% of those that we've surveyed raising, and also from the research with Vanguard, that this is where patients are having a lot of struggles. And when we ask ourselves, why is this the case? It's because, to be frank, communication is generally broken. There are a lot of steps involved when a patient is trying to get care. It can be everything from booking their appointment to getting instructions well in advance, right before the procedure, even afterwards. And then, of course, there are lots of steps involved in getting intake taken care of, getting their insurance. So there's just a lot of touch points, sometimes depending on the type of organization. It could be with a lot of different people. And this can create a lot of error. And this is also one of the things that's amplified by the fact that the majority of communication still happens via phone for most healthcare practices. So when you've got a lot of phone tag going on with patients, there can be just increased frustration, even though, the practice is trying to do its job, trying to be able to connect with this patient and really be able to deliver care. So when we dig a little bit deeper into this issue, what we find is that 13% of calls in healthcare as an average are abandoned. and 34% are missed. And that further compounds the problem. And then 85% of patients don't leave a voicemail for a variety of reasons, but that doesn't make anyone's job any easier when no one knows what the issue is, knows how to communicate. The result of all of this is that there's a lot of staff wastage of time. We have, from our research, it averages about 3 hours per staff per day playing phone tag. A lot of that coordination back and forth, how to get a hold of that patient. It can result in bad reviews, even though the practice is doing what it should be doing and trying to reach out, trying to communicate with that. Patients these days have access to a lot of tools where they can just kind of have an immediate response and leave a bad review. And then also it leads to attrition in practices. 67% of first-time patients do not come back for follow-ups or are lost in communication. And this is going to obviously be a pretty big deal for any health care practice, but particularly when it's someone who has care that they really need to have managed. So while we get into setup, what we like to do is talk a little bit now with Melissa and get a little bit of her view on the challenges in patient communication. So Melissa, just turning it over to you. Before you adopted a patient communication platform, what challenges did your practice experience around communication?
Sure. A lot of issues. So patients would call, and sometimes with the volume, calls would get missed, and we wouldn't, if they didn't leave a voicemail, we wouldn't know who called. Now with Klara, we can see that they called or we missed their call. It sends them a text message. And then when we, reach out to them through Klara messaging, or we call them, they say, "Oh, I didn't even leave a voicemail. I didn't know that, you saw that, the call even went through." So we're able to catch those patients now. I love that from wherever I am, I'm able to monitor all the calls and just see that we're getting back to patients in a timely way and nothing is falling through the cracks.
Great. And then what about any complaints patients had during that time period? What was their main things that they had issues around? Was it wait time? Was it just not hearing back or struggles booking appointments?
Sure. So, in an 8 to 5 practice, we have our busiest times at the beginning of the day, especially in a pediatric practice. The child wakes up sick, all the calls are from 8 to 9 a.m. So they're flooding in and they're waiting on hold. This way they're able to message us. More staff members are able to, help and they're all hands on deck during those busy times with them being able to message us. And with the scheduling app, we're also just able to send them the scheduling icon for them to self-schedule same day if they prefer as well. So that also helps with our time on the phone scheduling with patients. Do you want 8 a.m.? Do you want 8:30? Do you want 9? No, actually, can I do 1 p.m.? So they're able to just see everything in front of them and select the time based on their convenience.
Great. And then before you guys were using Klara, how was your team handling the inbound and outbound communication? Was it primarily through phone?
All phone. Mm-hmm.
And I imagine that there was an impact of these challenges on your practice before you guys worked with us. Is there anything there you can share with us?
Sure. So, when you're just primarily using phone, calls would drop. Sometimes it's staticky. We can't hear them. We have to call back. I also like that with Klara, it links it to the patient's chart, or we can see the full name, full phone number. If they leave a message, it's transcribed. It's there for everyone to see. We can add specific staff members into that thread, either for the patient to see or internally, where previously we were having to take extra time writing out a patient case, sending it to one specific person, moving it around. Now, if there's an incoming call and something needs to be taken care of, I can add all the staff members onto that message, and whoever sees it first can take care of it, document there that it's taken care of.
Great. Thank you. We'll move on to our next section now, which is around how there are different ways to automate workflows and routine communication. So like we mentioned before, there's a lot of steps in the journey for patients to get care, right? The continuum of care is well documented, but there are a lot of ways that patients can dive in and dive out of this process. Each one of these steps takes time for the staff to address, and frankly, for the patient as well. There's a lot of information that needs to be shared. Sometimes it's quick, timely, and other times there's a delay. As a result, physicians, staff are wasting a lot of time trying to manage all of this and trying to figure out how to manage that sharing of information. 70% of physicians spend at least 10 hours a week on patient paperwork. While I don't have a staff directly for here, I can speak that from my experience of spending time with staff, that there's a lot of staff time in the coordination as well. That's not solving the problem, but managing the problem. And 32% spend at least 20 hours a week on this. And this can have real impact on the organization when it's on average, we calculate it's about $50,000 in revenue per year for a health practice that's lost in all this time spent trying to figure out how to drive this communication, all this busy work that's involved. And how do we fix this problem? Well, at Klara, we take a look that said, we can't fix what's the patient's already trying to do. They're trying to get care. They're trying to coordinate this. They're trying to figure out a better way to do this. What we can do is help automate it and help make the process smoother through integration with the phone, through integration with different types of channels where patients can communicate, like text or chat. And when we put our automation in place, it allows the patient to have a much more seamless journey as they're trying to work with the practice. And that way the practice can spend more time with the patient. And we have a very robust engine that allows for this to happen, a rules engine that really matches the protocol, the workflow that happens within any one of the health practices. For instance, we can automate pre-visit communication with the patient. 7 days before a visit, the patient can get a notice about the appointment that's coming up and a reminder. This way we can help prevent no-shows or reschedules if they need to come back on a different day. 2 days before the visit, we can have an automated message go out that gives them a link to self-manage submitting their forms for insurance and uploading the information, all of it HIPAA compliant and showing up with inside of the Klara experience and also pushed to the EMR. So again, to remove a lot of that work. And a day before the visit, they can get another message where it gives them instructions, if there are any, that they have to follow in order before having their appointment. This way they have an opportunity, if something was to go wrong, to go back and reschedule if they weren't able to follow those instructions, or they can just know what they need to do and how to be prepared. So that way they can have a good visit. By automating all of these different opportunities to interact with the patient, we can save time for the practice, save time for the patient. We can reduce issues around waiting time, being able to get the forms received electronically ahead of time and entered into the EMRs. And most importantly, making sure that the patient shows up, which at the end of the day is the most critical thing so they can get their care. And this is just one way that we can do this, one way that we can touch the patient through any of our different ways of interacting and help drive savings and a return for the practice. And this really allows the patient to have a streamlined experience with the practice. They're able to spend time taking care of the necessary tasks that they need to do, but really focused on their care and being able to communicate with the practice to get their care. There's no loss in phone, right? They can't miss a call if we're sending them messages through email and through SMS, allowing them to take action. They can do it on their own time too. All of these messages are persistent, so they can follow the links. They can go and take care of whatever tasks they have. And we know that it creates a better experience when we're able to sync this with the EHR, removing workload from the practices as well, and making sure that information is there and is accurate. I'm going to turn it back over to you, Melissa, and ask a couple more questions. So can you give us some examples of how you guys are using Klara to streamline some of your communication and what results you've had?
Absolutely. So prior to Klara, we were using all paper forms for check-in and things like that. Now we've completely moved to e-forms. A lot of the appointment types I've been able to automate, so we don't even have to manually send those out. Based on the appointment type, it sends out specific set of forms for them to complete prior to the visit. When we were using paper forms at each of our 3 offices, it would take out at least an hour of our staff's time printing those forms out for the next day. And then if a patient no-shows, we're throwing those papers away. So that's waste, and then we have to just do it all over again. When it's all e-forms, we don't have to worry about that. It makes it so much easier. We've saved so much time. And we've also, my favorite template that I've created is a COVID screening template that gets sent out to every single patient at 7 a.m. prior to their appointments that says, please be aware that masks are required to enter. And then here's the COVID screening form to complete prior to entering the building. Of course, with paper forms, we were not really able to, set something up like that. They would just come inside. Now we're able to even follow COVID protocols more closely.
Thank you. How does secure messaging improve your staff's productivity, being able to triage requests, internal collaboration? I don't think folks here don't know about the inbox, don't know how they get to interact with Klara. Can you talk a little bit about what that experience is like for you guys?
Absolutely. So I've been able to create different types of inboxes based on the patient's needs. So if they're asking the medical question, that will come to our triage staff, and then they can also send that to the providers if necessary. Unassigned messages, I've set that up to come to our all of our front desk staff to manage, whoever sees it first. I've created several inboxes. I love them. Also an after hours on-call inbox. So I even have that go after hours to whichever provider is on call. And then they're able to just see the message directly when before we had to go through an answering service. And they don't have access to Athena. So they don't, they have to get the information directly from the patient. Sometimes that would result in incorrect names, incorrect dates of birth, and issues with direct communication. So now those messages are able to come directly to our on-call providers as well.
Awesome. Thanks for sharing it. And just so paint the picture for everyone who's watching the webinar and listening in, when patients use any of the different channels in which they can communicate with us, it all flows into a central inbox. If it's a voicemail, it's transcribed to text as well as the audio recording. If it's a message sent in via, say, the widget that sits on your website and lets patients just type and talk directly to you, that same messages will all show up inside of the inbox. Each patient has their own inbox as well, where all these communications show up, so nothing is lost. So if they're talking to a bunch of different questions, it's all there, even if there are different people on staff who are managing those answers to the patient. Melissa, can you share a little bit about an example of how you've used Klara then to streamline your communication and how that has impacted your metrics?
Absolutely. So the appointment reminders have been very useful, just those automated reminders. We're also able to now send requests for reviews after their visits. So they say they can press 1 if they've been very satisfied with the visit, and then that prompts an automated review request to send out, and our reviews have increased from that, which we're very happy about. And if they were dissatisfied with the visit, then it sends them, it prompts them to press 2, and they're able to tell us what they were not happy with regarding the visit. That's also been very helpful for me being able to give our staff feedback on what we can do better and what we can improve. And it also improves communication between us and our patients and creates more trust there.
Thanks for sharing that. And trust actually is, I think, a key word here. I mean, with any patient experience, any solution in the market, if it's not helping build trust, it's not really delivering a lot of value. And that's something that we want to make sure that Klara does.
Agreed.
Great. Moving on to our next section then. So let's take a look about Klara and Athena Health and talk a little bit about how we work and we operate with Athena Health. So our rules are completely customizable. We have a lot of rules that we can apply to the message, to the automation that allows for different activities to happen based on the appointment coming in or the type of message that's coming in, and really helps streamline the workflow that's happening generally through all this different, whether it's email or a phone call or whatever type of channel that's occurring through. We're allowed to we can bring that all in, we can automate it, and then we can push it straight to the EMR. So it can really match the protocols that you might work in your practices, the workflow that you've established about who handles what when, kind of like Melissa talked about how their after hours can be brought in, the messages can be triaged, they can show up inside of the inboxes, and they can even be written back to the EMR too as notes for that patient, which is incredibly valuable, for a lot of practices. And like any true system of engagement with Klara, we integrate with the phones, but we also do these other channels that we connect to with the patient, whether it's an SMS message, whether it is through an app, whether it is through the website, or an email that we send. All of that information, as I mentioned, flows into Klara, flows into our inbox. It is synced with the patient record. Whatever we have, whatever we can, we sync it back. We allow demographic data, if we get a capture of their insurance card. All of this information we try to sync back. And as I mentioned, you can clip messages and put just those select messages in as additional comments or notes for the patient. We can collect the paperwork digitally. This is an area that we're continuing to invest in 2022. We're going to continue to add more capability here to write back discrete data field elements, not just capture these forms and upload them, not just capture the demographic data and put that into the EMRs, but we want to be able to start helping even move around small pieces of information into the EMRs where possible, into Athena Health. And we can automate those instructions, as I mentioned, both pre and post. So we can do multiples, right? So it doesn't just have to be one message ahead of time. We could send them the messages to let them know about their appointment. As I mentioned, we can also do things like pre and post visit instructions that they should do in follow-up, and then also do follow-up appointments so that way they come back if they have additional care. Allow them to take action on that. And we'll continue to build out more capabilities on that front this year as well. It's another area that we're investing in. We allow patients to easily reschedule their appointments. They get this in any of the messages they have. There's a call to action where they can go and reschedule. All of it can be done online. It's the same appointment inventory that you make available through Athena Health for the patients. That's what they have access to. They don't have access to any other appointments. And they can take an action. They can book that appointment and have it show up inside of the Athena Health system. And then we can increase patient retention through customer appointment follow-up and messaging. And this is it's kind of pretty open-ended. There's a lot of different types of messages that we can send out, whether it's a broadcast about an emergency and a closure in one of the practices, or a message that needs to just go out and remind patients that flu season's coming up and they should be booking care. So there's a lot of ways to take these specific actions. So that's just one way that we work with Athena Health to help expand with the practices. As I mentioned earlier, it doesn't matter which one of our channels that patients are using to communicate: web chat, texting, call to text, voicemail. This is a screenshot that's showing you one of those conversations with the patients. All of that information flows into the inbox. The little area that's probably hard to view on your screen, but on the right-hand side is of the view is all the information the patient has submitted and all the information that we have that's available, being able to be just surfaced right there inside of the product. So you can see what appointment they're referring to, or see if they really did fill out the form like you were supposed to. You can go back, you can look at that history. We even have the ability for you to bring in others, whether that was inside of your practice. You can mention them and they'll get brought into the communication. The patient won't be able to do anything with it initially. I mean, they can respond to the message to say something, but it's more important that you can bring somebody in who can answer that specific question, and they can then contribute to the conversation. And we even have the ability to bridge out across organizations, allowing for an external actor to come into the conversation, only seeing the information that's pertinent, but being able to go in and so it's like it's a pharmacy and you want to coordinate with the patient, with the pharmacy on getting prescriptions. You can do that right inside of Klara and have that conversation with the patient and someone, say, from the pharmacy. So let's talk a little bit, back to Melissa, a little bit about how you guys are doing your integration with Athena Health and how that works. Can you talk a bit about how this has helped your practice?
Yes. So actually touching on your point, when you said we can export messages from patients directly into Athena, that has been very key for our practice. So previously, either phone staff or the on-call providers would have to type up their own message regarding what the patient had described over the phone. Now, if they, write out what symptoms the patients are experiencing and what course of action they took, we can just take that and export it directly into the EHR, and then the provider can write their own notes alongside that. So that's been a good time saver, and it also helps maintain kind of the integrity of the communication that's happening. If the front phone desk staff are just exporting that message directly from the parent to the provider for the provider to review, there's no, it's straight out of the patient's mouth. to say. But so that's been very useful. Also, with any patients are able to send pictures and videos. Our new moms have definitely been doing that, and that's been very helpful for our providers to just kind of see what exactly is going on. One of the parents had sent kind of a swollen arm of a patient after an injection, a vaccine, asking, is this normal swelling? And then we were actually able to save that patient, an unnecessary office visit, since it looked like normal swelling from the picture. So just things like that.
Great. And for your practices, what would you say is the best part about integrating with Athena Health? You named a bunch. Which one is? Did you have to choose one? Which is the best?
The best one. Oh gosh. I would say that the patient messages. I really like exporting the patient messages directly into Athena. The forms as well. Before we were having to manually fax in the paper forms into Athena, I really enjoy being able to directly fax or export them into Athena. Oh, and the driver's license and insurance cards. We don't have to touch those anymore. The patients upload those themselves, and we directly export it to the chart.
Awesome. Those are 3. Appreciate it.
Yeah, I know. Yes, for one.
What would you say? What would you say to a practice who's considering Athena Health and Klara? Like, what would you tell them that is the benefit that they're going to get and the value of the 2 products working together?
I think this is ideal, especially for a primary care practice or any practice that wants to, improve communication. That is going to be 24/7 with their patients. It's made everything a lot easier for us to have this, telecommunications platform. We're able to get much more information from the patients prior to the visit. They can upload their insurance cards. We can verify their insurance, if anything. If we need to edit anything or update their insurance, we're able to just reach out to them about that. They send their insurance. If we need to reschedule their appointments, we send them a reschedule calendar link. It's opened a world of options for us.
Great. I'm glad to hear that. And you guys are finding this great value out of it. We're going to open this up into our last section for discussion. We're going to talk about ideas, forward-thinking ideas on improving the patient experience, kind of get some thoughts from Melissa and your experience. So, after implementing Klara and getting a better patient experience strategy in place, what's worked well for your practice and what hasn't worked well?
With Klara?
Yeah.
I would say we'll start with some, hurdles we have to overcome. I think sometimes there were some issues attaching phone numbers to the actual patient's chart or merging charts if there were duplicate things. But I think overall Klara has made that pretty easy to handle. And if we ever reached out to Klara through their kind of help chat bubble, they've been very quick at fixing any issues with that. And that's not even such a huge issue because we're already getting so much more information using Klara to begin with. So we're able to, get past that. And our staff have actually been amazing at merging charts or connecting any charts to the EHR. So I would say that's just the main thing that we've just kind of had to, starting off, make sure that, everything is all connected to the EHR. What was the other question?
I think what's worked.
What has worked well?
Yeah.
I think that I've really enjoyed being able to communicate with patients after hours. Personally, I'm a workaholic. I like being able to see those messages come straight to my phone or laptop, and I can just handle it on the spot. So I think it's improved accessibility. But then we're also able to send out a message that, currently our office is closed. Again, that's automated through Klara. Currently our office is closed. Please allow for delay in response. We'll be back tomorrow, 8 to 5. So I think it's just improved communication overall.
Is there an aspect of the patient communication and journey that you still struggle with as an organization today?
There are certain patients that do prefer to speak over the phone, but I think that's fine. We just give them a call, as we were already doing. Anything that Klara could add? I'm wondering. I think, and I've posed a million questions to Klara as well. I think I probably message Klara several times a day with ideas. Can Klara do this and that? And, they always tell me that actually they're working on it. I would like, for Athena users, I would like us to be able to collect payments prior to the visit as well.
Yeah.
I know that I think you guys have that available for a different EHR system. And anything else? Sometimes I'm wondering, we have to have patients fill out forms if they want us to fill something out, like school forms, things like this, like sports forms. If we could send them out like a blank form for them to fill out the first part, and then the provider can fill out the rest through Klara, that would be also an option.
I like that idea. I'll take it back to the team.
Great.
Cool. How would you describe an ideal patient interaction? Like what does that look like for you guys in the ideal world?
Sure. Ideally, they reach out to us and they are able to self-register in some way and self-schedule. Unless they, just as an option, unless, they would like us to help with that aspect. And they can upload their own documents, the driver's license, insurance card, any past medical records, which is currently an option. Paying prior to the visit once we verified the insurance and understood their insurance benefits. And then filling out any forms prior to the visit. And then they're able to just be checked right in and taken back to a room. And then post-visit, we're able to send the post-visit instructions and a request for a review. That sounds good to me.
And what advice would you give to a practice that's just starting this process to look for streamlining their patient communication? What would you tell them ahead of time so that they know how to get the best value out of Klara or anyone that they work with?
Sure. I think what has helped with us, because I think starting off, we were very nervous. Are patients going to adopt this? What are they going to think about this? Of course, they were, issues. They got random text to their phone. Oh, is this, a legitimate link? So we were able to kind of automate it, to send automated messages. When they're automated, they're able to see those directly on their phone. They don't have to click an external link. So if they see the provider's name, hi, this is Dr. O, this is our platform that we're now using, that's, they trust the platform more. And I think really doing a full staff training with front desk staff, triage staff, medical assistants, providers, to get everyone on board. If there are any patient questions, everyone is able to kind of help answer or at least guide them to the practice manager who can answer those questions. It's really just about making everyone feel comfortable. This is a new platform. It's here to make everyone's lives easier. We've noticed maybe newer patients are, more easily adopted than the established patients. They say, oh, why do I have to just upload it? Why can't I just give you my insurance card, driver's license? So they kind of ease them into it. But I think eventually they realized it made things a lot easier.
Great. Thank you. Well, it looks like we're at the end of our presentation. Thank you to you, Melissa, for participating. Dr. Carmichael appears wasn't able to join us today, probably got tied up in something. We're going to move to some Q&A in time. I know we're a little ahead of schedule, but maybe give people a little bit of time back for their lives. We have a whole bunch of questions that are coming in. If you do have more, you can type it into the questions inside your web interface and submit them. I'm going to start answering some of them that have been kind of queued up for me to take a look at. So I think this was asked, and just make sure that people heard the answer, and we talked about it earlier. This question was around, do we only work with smartphones, or is there a browser option? And the answer is yes. Klara works across all different communication channels. So we have the ability to accept phone calls and phone messages. We have an app for iOS and for Android that allows patients to interact as well. We have, and providers, I should say. We also have the ability for on the website, a little widget that can be put on the website opens up and allows patients to communicate into that channel as well, SMS and also email. Now, in email, of course, we don't allow patients to submit a form interactively. They have to click on a link and go to a web page, but we can communicate with patients also via email. Wherever we can, we are HIPAA compliant, and making sure we're also being very mindful of any other any information that we shouldn't be sharing. We try to stick to all the rules of HIPAA and make sure that the patients are taken care of. One of the other questions we've been asked is around the patient hours that patients can communicate. So we believe that patients should be able to communicate. We don't want to put up hard blocks in front of them. And so the Klara interface is always available to them. They can always go and submit a question. However, we allow practices, because people deserve some time, to themselves, to define your hours. We allow you to define your vacation hours, even if it's, you close for a holiday, or we allow you to, if you have an emergency, you can close your office. You can close for those hours as well, and let patients get automated messages letting them know about when you're going to be available, when they can expect a response, to set that the right tone with them about what to do. So we do have the ability for them to communicate as they need to, but then let the system let them know that you're available or not available. And again, we can do things like Melissa highlighted, where if there's an after hours inbox, they leave a voicemail, it can show up, be captured, and be available for your practice to take a look at in the morning. How responsive is Klara's customer support? I like to say that they're super responsive. They're always available inside the application. We have a ability for anyone who's a provider side to be able to submit questions and try to get help. We have a pretty extensive library of resources and best practices and how to utilize the product. And our team is always reaching out to folks to try to help solve issues or help them with configuration, getting the best out of the system. My product organization, we take feedback all the time from folks like Melissa and others, and are also pretty responsive in trying to figure out solutions and come up with some new capabilities, adding it to the product. So we work pretty a lot to keep building out this great experience and great product, and we'll continue to take all the great feedback we get. One of the questions is, can you send screening questions to the patient before their visit with registration forms, such as gender identification, sexual orientation, et cetera? How does this information come back to Athena? Is it a PDF or discrete data? So Klara does have customizable forms. You can create your own capability forms, whatever you need to capture in terms of information. The majority of the forms that we capture right now are captured and submitted as PDFs. We do have the ability to allow for submitting into Athena other data elements like uploaded images of the driver's license and insurance, as well as syncing demographic data. We can take care of that, as well as messages. This year on our roadmap, the team is actively working on looking at discrete write back where we can, as well as matching to the form discrete write back. So that is on our roadmap for this year to add more of that capability. Is there any way to communicate within the care team through Klara? So yes, you can. You can communicate and coordinate around a patient inside of their chat. There are ways to type a message to each other. The patient will not see it. You can mention each other. They can be private messages just between staff and the doctors and whoever else you want to involve without the patient getting any of those messages. So we certainly have also had some clients who've gotten creative and set up a lunchtime patient so they can communicate about lunch as well. And so there are other ways that people have used our product, but you do have the ability to collaborate without patient seeing the messages and being able to communicate amongst staff. What complaints have patients had regarding Klara? That's a good question. So I don't know if patients have had direct complaints about Klara per se. There's always the question about how do I get, I can't get my provider and how do I access? And that's usually just a reminder to them that they have to. When we send them a message to log in, they need to submit a couple pieces of data. We send them a unique character code they have to type in, and they have to confirm their date of birth. So sometimes patients just get a little stumbled up on that. They always would love to submit more information or be able to have take additional actions. So we are looking at trying to figure out how we can allow for some of that. Example being, right now, if they have prescription refills, they have to write a message to the practice about getting a prescription refilled, and the practice takes their action. We've heard some patients say, hey, it would be great if I could just know my medication and basically they want to send an automated message, a template back to the practice to say, I need a refill. when their date's up. So patients have tried to look for ways that they can streamline their interactions with our product. And I think the last thing is, of course, and this is depending on the practice response. When can they get a response? When do they know the message has been received? So this is an area that we're continuing to look at and see what we can do to help patients feel that they've been heard and acknowledge that they've sent something inbound. But at the same time, recognizing that the practices need to be able to work, and we shouldn't create an expectation that can't be satisfied by the organization. Mm-hmm. Is there a way... That's a duplicate. Okay, sorry. I'm going to jump to the channel and see which ones we haven't answered. Starting from the top of the list. Are you able to send information? Yes, they're going to send this out for the slides and the recording, so folks will be able to kind of go back and review any of the information that's already been shared. And of course, we're happy to follow up, and our website is available for any additional information or the marketplace information within Athena Health. Can explain how Klara integrates with the phone. So we work with you to set up phone numbers that allow, we can use yours that already exist, allow for the messages to be brought into our system. There's a couple different ways that we go about doing this, but most straightforward is we take over your phone number. The phone can still ring through to your office. There's nothing that stops that from happening if you wanted to, but we can also catch the messages as voicemails as patients go through and interact, and allow for those messages to be transcribed and put into the inboxes. So we are looking at more ways to expand and work with specific phone systems. But right now we have the ability to kind of just take on that for you and be able to capture those as part of this process, and then again, pass through to your practice any of the messages that you want to.
Yes, if I can jump in quickly.
Sure.
So yeah. Before, we would have option 1 to schedule an appointment, 2 for medical records requests and forms, things like that. So we don't even use our physical phones as those inboxes anymore. They all come to Klara, so we're all able to see them from any location. It's just been able to put everything in the cloud, basically. That's very useful for me as a manager from wherever I am.
Awesome. Thank you for that, adding to that.
Yeah.
There's a question of how do you authenticate with Klara? So I'm going to cover both provider and patient real quick. On the patient side, as I mentioned, patients can access through any of the channels, but anytime that they do, they have to, we send them a unique code that they need, that we on the phone number that we have on record, that they have to take and enter into Klara. And then the next thing they have to do is verify their date of birth in order to kind of, that's how we understand who they are and make sure that they can log into Klara and be able to communicate with the practice. For the provider side, we support ID and password, and we have what's called SSO, single sign-on. We're continuing to expand that, and we'll continue to add more authentication mechanisms to that, which will allow anyone to be able to access via just a single, if you already have a single login for your organization. And the question specifically asks if we use Okta, and Okta is who we use as that provider as well. Can you explain how, sorry, Melissa?
I log in on my phone with Face ID. I'm able to do that. I appreciate that option.
Another question is do we know how long on average it takes for staff to become proficient with Klara and Athena integration? So again, we help a lot in getting the setup. So we can help make this a very easy process for practices to get on board. We have an onboarding process that we work through, make sure that we get the Athena Health instance integrated with our solution, so that way we can start exchanging data. We walk you through that whole setup process. We help you with the setup and configuration of your rules and help you get familiar with that. And we have a lot of materials, like we mentioned, to help practices get going. We have standard templates that we can utilize so that you can customize things as you wish or create more. But we give you some stuff right out of the box, so that way you don't have to start from scratch. The system is very simple to use. We spend a lot of time on keeping it simple and easy, and removing any excess clicks in there, so that way it can stay pretty streamlined. And so I don't know the exact time frame, but most practices can be up and running pretty quickly once we get through that initial configuration and setup. And so if it's being utilized by the practice, everyone has been trained and in there, you can immediately start seeing real benefits in patients trying to reach out, get contact, and starting to submit information. It isn't one that you have to wait 6 months or more to start seeing real benefits. It can happen immediately. Can we do a test session? Well, you can definitely say only onboard a handful of patients a period of time. Yeah, I mean, there's certainly ways for you to manage how people are interacting, how you expose it. If you only want to be able to have certain patients and tell them about it, there's ways to do that. There is no way to kind of restrict your patient population inside of like the connection with Athena. That we have to sync to make it available. But it doesn't mean that they get communicated with right away, and because we have to have appointments and you have to have templates set up. So there are ways that you can kind of restrict it for your own initial pilot in order to figure out what you want to do to roll it out more widely. People get confused with Klara and Klarna. So funny enough, when I joined Klara, a good friend of mine could not get that correct when I kept saying Klara. And he's like, "Oh, you work for Klarna?" And I'm like, "No, I work for Klara." And we went back and forth. He totally understood what we were doing in the business, and he went to the website. He just kept calling it the wrong name. Certainly, yeah, I'm sure it happens. I'm sure some folks get the name confused. But most of the patients who are working with it are working through either your website and the chat channel that's on there, or they're using like the text messaging that they already have, or they're using the app. So it's a lot less confusion than you would think. But yeah, I'm sure there's some folks out there who get the name a little confused. I'm getting the queue. It's ready to wrap up. So we have more questions here we should get to. I'm sure we can type some answers to them. We'll share the decks. We'll share all that information with you guys. Really appreciate folks taking the time to hear us. On this slide is some of our contact information for emails if you want to contact folks with direct questions. And thank you for taking the time. Thank you, Melissa, for answering all the questions and sharing your insights. And I hope you all have a great day.
Thank you.